Good morning. My name is Savannah Rose. I'm the invigilator for your OIT speaking test conducting on the 16th of January 2021. Can you say your name for the record, please?
Good morning, Savannah. My name is Dylan Hunter.
And what is your candidate number, please?
My candidate number is 217143430.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right. I got it.
What are your long-term career goals?
Like many other nurses, labor and delivery are what initially got me passionate about nursing. It is where I would love to spend the rest of my career. After 8 to 10 years, I hope to be ready to pursue a management position in the same department. I could easily see myself staying in this department for the rest of my career.
Teamwork is essential to the functioning of any labor and delivery unit. What do you do to maintain a teamwork mentality?
The most important part of teamwork is for all individuals to realize that they should not expect to be the star. While everyone would like to be recognized for doing their jobs well, this is often not the case. I have learned to just focus on the patients and ensure that they receive the care they need when they need it. If this means I pitch in and help another nurse place a difficult IV line, that's what it means. I maintain the mentality that every patient on the floor is potentially my patient, and that has done a world of good in helping me remember that we work as a team.
Mistakes happen. Please tell me about a time you made a mistake that had a negative impact on a patient and how you handled it.
I was on my first assignment just shortly after I finished clinicals when I had a patient come in who was diagnosed with congestive heart failure. When the doctor prescribed his medications, I misread the chart and gave him the wrong dose of a medication. His vitals started to drop and we couldn't figure out why until I double-checked that everything had been administered properly. I immediately notified the doctor of the mistake and we were able to rectify the situation with little effect on the patient. It was a terrible situation, but I knew I had to be accountable for my mistake, or the patient would be the one to pay for it.
When nurses make mistakes, it can cost lives. How do you plan on minimizing mistakes?
Vigilance is the greatest tool any nurse can possess. I minimize mistakes by constantly checking and rechecking to ensure that medications are properly administered and that patients receive the preventative care they need, and by placing patient safety above all else. I also follow all hospital protocols and procedures at all times to minimize mistakes.
What's your greatest weakness?
Even after years of experience as an ICU nurse, I still get a little stumped when I see deeply wounded accident cases. When I first began working as an ICU nurse, my mind used to go numb when I would see a patient with horrible injuries. There were times when I couldn't even be proactive and handle the matter smartly. When I realized this weakness, I started meditating regularly to train my mind to remain calm in emergency situations. Over the years, the meditation truly helped me and I was better able to handle gory wounds and accident cases.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
Excuse me, please.
Yes. How may I help you?
May I know the patient's name, please?
You can call the patient Savannah.
Thank you.
Your preparation time is over. Now you can start your role play. Don't worry if I stop the role play when the time is up.
Hi, good afternoon, Savannah. I'm Dylan Hunter, one of the nurses in the maternity wards.
Nurse. I have severe pain in my wrists and shoulders.
I'm so sorry to hear that. Well, let me please go through your medical files, please.
Okay.
Savannah, according to the report, the doctor has diagnosed that you have rheumatoid arthritis.
Yes, I am aware of it. But I can't withstand this pain. I'm feeling very fatigued, as the pain is disturbing my sleep.
I can understand your situation. I am sorry to hear that. However, your doctor has prescribed oral medications for that. Did you take them?
No. I didn't.
Savannah, these medications are very effective to slow the progress of the disease, control your symptoms, and reduce pain.
Yes, I know that. But, I don't want to take this oral medication.
Oh. Is it? Could you please tell me why you did not take them?
Nurse, I fear that the medication may harm my baby, as I'm determined to breastfeed the baby.
For your knowledge, I can explain that rheumatoid arthritis is not an infectious disease. It cannot be transmitted from a mother to her baby during delivery or through breast milk.
No, nurse. I'm not confident to take the prescribed medications.
Your fear is considerable. However, they have been used in clinical practice for many years. There are no unpleasant side effects on your breastfeeding. So, don't worry about breastfeeding while using this medication. Our doctors are really experts, and they are capable of managing these situations. So, you can take your medications without any fear.
Are there any remedies for this pain, other than taking these oral medications?
Apart from oral tablets, there are other forms of medications, such as gel and cream.
Could you explain it to me, please?
Of course. I'm glad to explain it to you. Gel and cream are used in the topical areas where they are needed. They are not dependent on circulation through the bloodstream, so they are safe to be used during your breastfeeding.
Oh. That's great.
However, I insist you follow the doctor's prescription for a better result.
No. I don't think it is safe for my baby. I insist on using a natural gel product that contains capsaicin and is reputed to help with pain relief.
Calm down, Savannah. I can assure you that the oral medication will not do any kind of harm to you and your baby. Instead, the oral medication will give you much better relief from your condition. It will lower your pain, and hence you will get a good sleep.
All right. I acknowledge you. If I'm taking this medicine, how fast I can get a good sleep?
With regard to your sleeping problems, we have some other types of treatments, which may be equally effective as taking medications. We will arrange a warm bath, and then offer you a glass of warm milk for you, before you go to bed tonight. We will see if they work.
All right. It sounds good. But nurse, the intensity of pain is increasing. Please, do something quickly.
Now, the important problem is that you are in so much pain. I will let your doctor know. He will probably review you soon. And I will get you a hot pack. The warm compress will be helpful for you to relieve pain.
Thank you, nurse.
Have you got any family or friends to help you? If I contact them and arrange for them to visit you, or stay with you for a while, would you feel better?
Yes, please. Contact my husband. He will be there in the waiting room.
All right. I'll make the necessary arrangements at the earliest.
Nurse, how soon I should expect to be able to go home?
Generally, a week after the Cesarean section you can go back home. But, it also depends. When your wounds heal well, there are no complications, and your pain is controlled very well, you will be able to go home.
All right. I got it.
Savannah, let me do the things for you, as we have discussed right now. Meanwhile, if you need any assistance, please ring the bell on the right-hand side of your bed.
Sure, nurse.
I wish you a speedy recovery and very happy motherhood.
Thank you.
You are very welcome.
That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.